Okay, thank you very much. Like I said, I'm J.D. Steed. I'm a family doctor, and I love taking care of patients. But what I really love to do is design a system. And where better to start than in the healthcare system? There are a lot of things that we can improve on. And so J. Edward Deming one time said, every system is perfectly designed to give you the results that you program it for. So we have a system, go ahead, that looks a little bit like this. So the taxi system was the foundation of how you got around cities forever. But it was inefficient, cost a lot of money, and it just wasn't very friendly until Uber came along and changed everything. This is what our healthcare system looks like right now. And we think we can make a big difference, just like Uber did, among the healthcare market. Go ahead to the next slide. So this is what employers are looking at, and we really want to help employers. In this market these days, you have, let's see if this works. I guess you can see that, yeah. So employers paying the dark blue, employees paying the light blue, and over the last 18 years, costs have tripled in healthcare for what folks are paying. Do you think care has improved 3 times as much in that time period? I don't think so. The other thing we're facing is a really competitive marketplace. So especially in this time with all the construction and building and business booming, you have employees that you want to keep at your office that are at risk to go elsewhere. Could you design a healthcare system that people love that keep them at their business? How many of you folks have come up to you, if you're a business owner, and says, Doc, I just love, not Doc, that's what they say to me, Mr. Businessman, Mrs. Businessman, how much, I really love this job because of the healthcare benefits. That's what we want to design, a benefit that is really worth its while. But let's look at the whole system, how it works. Here is the Taxicab Fee-for-Service system. And so for every time a doctor submits a $100 charge, his collection rate, which I didn't even show here, it's in white, he has 65% of that to work with. Because of there's regulations from Medicare, from insurance companies, drives up overhead. 60% of what you have left is in overhead. So at the end of the day, there's a profit margin of $26. Unfortunately, what that does is it creates a system where the doctors say, well, how can I rev this up? I can see more patients. I can do more things to them. I can see patients in 10 to 15 minutes, which is not patient-friendly. What we have is a system called direct primary care, which based on a monthly membership where we bill the patients directly or the business directly. We collect from those folks 99% of the dollars that we bill for. Our overhead, because we don't have the regulations, the insurance things to keep up with, 18%. So that sets us left with $81 of that $100 charge. Now, we could ramp things up and rev things up and put people on the hamster wheel, but you know what? This system over here, the fee-for-service system, burns doctors out. And patients are tired of it too. What we've designed is a system where you can see we will max out at 500 to 700 patients per provider, and we will see them for an hour-long, half-hour-long appointment, and some other creative things. So next slide here. Monthly membership, we will see them, give them 24/7 access to care. So because I only carry 500 patients, I can take care of them. I can spend time with them, and I will always see them for a same-day visit, whether it's Christmas, New Year's, whatever day. We're here and we're available, and we are building a network of direct primary care doctors in this community. Another cool thing is you have an employee that's at work. This happened yesterday. Someone at Osley Construction called me, had a complaint. 80% of the time, the doctor can tell you what's going on with you by a conversation. The other 20%, you need labs, you need x-rays and stuff like that. But 80% of the time, you can do that. So we talk to people over the phone. We book phone visits that you can directly access the doctor. We also have a texting app where you can securely text the doctor. So typically in our office, you will not hear the phone ring. You'll also not see a busy waiting room. But you'll not hear the phone ring because so many people are texting us. Can I get an appointment? What do you think about this rash? Hey, I had an allergic reaction to this. What do you think? We can text back and forth. And of course we can always call, and you can always come in. One great thing, why would we charge a copay? A copay is a disincentive to be seen. People are already investing us, and we want to invest back in the community. And then one other thing, 90% discounts on labs, x-rays, and meds. Now, this is not a direct primary care thing. You can do that. You can go out, if you are not going to reach your deductible, ask for cash pay pricing in anything that you get, because cash pay pricing can be up to 90% off. So here's what we're trying to do. We're trying to reach out to businesses in the local community. Now, everybody wants to ask me, so what do you charge, Doc? So for adults, we charge $40 to $100 per member per month. But we said, you know, let's really support local businesses. I love the CEP, especially the P stands for partnership. And we want to partner with local businesses and offer them up to 50% off those prices. So that's what we pay per individual. And there's a couple folks in town, Ben from the Zone and Angie Lewis, that have already started using their services. They have invested in direct primary care for their folks, but they don't complement that necessarily with insurance. The next slide I want to show you is how it should really be done. So Kim Green, who's here, Ken Osley, who's here, we got together as a team, and we said, let's try an experiment. Ken's facing a 20% increase in his insurance premiums over the next year. Let's see if we offer the gold plan, which is kind of like the color of a taxi cab to people, to folks, and this is how much it was going to cost his office. And Ken's gave me authorization to share these numbers, as has Kim. But they said, let's list it for that, and let's present this program to our folks and see if they would take the direct primary care option. So you have a little bit higher deductible, a little bit higher out-of-pocket maximum, but man, if we could swing people over here, it would be a really sweet thing. Less cost, better care with direct primary care, and a net savings of $36,000. So Osley Construction let them choose. All 11 employees come to this column, in the silver column. Next slide. These are the local companies that support us, and we just want to get the word out. We think this is a better care and a better system and a better way for employers and also for individuals. So I'd love to see it. We're right up next to, just north of Tuscaloosa Park on Bonnie Heath. Not many doctors give out their cell phone number, but I love talking to people. So there you go. You can email us. So thank you very much.